Hello, and how are you? Welcome to the second part of nursing case study. We are going to focus on objectives of nursing care case study. My name is Winnie Barawa. If you're new here, this lesson or this channel rather focuses on lessons, lectures, and expert interviews pertaining to healthcare. If this is an area of your interest, don't forget to give us a subscribe or rather subscribe. Click on the bell so that you can be notified when we put our next lessons and also comment on this video. If you're a returning subscriber or you're a returning member and you've never shared these videos, this is the moment that you can also be part of our sharing community. Thank you so much, and let's keep it all the way to the end. So let's look at the objectives of nursing case study. So in the first lesson that we did, we looked at the aims. If you've not watched, you can refer to that. We looked at the aims of nursing case study. Now the objectives of the nursing care case study, it's very specific. In the aims, we just looked generally what are the benefits that will come out of doing a nursing care case study. But in the objectives, you're going to look at what are the key things that we are going to carry out in the nursing care case study. So in the objective, one of it is to assess the patient condition holistically. So in this case, we shall participate in the assessment bit. We shall conduct several aspects like history taking, physical examination that can be including of head to toe or systemic. And then it can also include things like diagnostic checks like x-rays, imaging, blood works. But also this aspect has other assessments like vital signs. This is the same aspect where you can do review of systems. So assessment is very broad, but this like takes majority part of the nursing care case study. But this is part of the objective that we are going to do while we are conducting a nursing care case study. Then the second bit is to identify specific health needs of the patient. And in identifying specific needs of the patient, this is like synthesizing. So you have collected this data via assessment of the patient. You've done history taking, you've done physical exam. You have all this information that you've collected from our client. What are we going to do with it? So this part or this second part is now what kind of takes us into the diagnosis part of our client, but you're doing a synthesized kind of approach. You want to dig deep into this information. You want to data analyze before you can make a diagnosis, relate each and every aspect of your client. So you can relate to this like pain issues, activities of daily living. So ADL means activities of daily living. You could be doing ABCs. So ABCs, this is checking needs based on airway, breathing, circulation, disability, exposure. So ABC goes all the way from A, B, C, D, all the way to F. So with A is for airway, B is for breathing, C is for circulation, D is for any presence of disability, E is for any exposure to some environmental elements that could be leading to more health needs, and F is about follow-up needs. So these are areas you want to check on. So there's A, B, C, D, E, Fs. You can have the pain, you can have the ADLs. So with ADLs, we're talking about activities of daily living. And the other objectives you're gonna do is to formulate a nursing care plan that will show the nursing interventions to be implemented and the rationale for them. So when you're doing formulation of nursing care plan, it will be very specific because it's going to prioritize the needs of the client, the areas that you want to focus more on, how you're going to implement them, and then the rationale why these are the specific interventions you want to implement. And the fourth part is to implement the nursing interventions that are appropriate and effective for the patient identified needs or conditions. So with implementation of the intervention, here you are talking about timely interventions that are relating to the needs of the client. And remember, you could identify so many needs, like in level 2 or number 2, you'll have identified so many needs. But as a nurse who understands patient implementation, you want to look at beneficial and prioritized need that needs to be given first. And then at level 5 here now, it's about evaluation. So we are going to evaluate the outcome of the nursing care through monitoring of the patient progress. So to summarize the objectives of a nursing care case study, we are looking at assessing the patient condition, identifying specific needs, formulating nursing care plans, implementing interventions, and evaluating of the nursing care. So that's a summarized way of handling objectives of a nursing care case study. Then we have what is the importance of anyone doing a nursing case study, more so to the students, because students are majority of who are required to do nursing care case study, most like a requirement for their degree or undergrad or the purpose of meeting requirements for graduation. So one of it is to promote relationship between the student, patient, and the family members. So this is part of teaching students how to achieve effective communication skills or interpersonal skills. But it also gives that student a chance or an opportunity to learn, to get to explore on practical cases and be able to relate all these cases to real life opportunities or to real life cases. And then number 4 is improves the student problem solving skills and approaches. When a student handles a real case scenario, that is, they have a real patient, taking history from it, doing physical examination, doing synthesis by analyzing and making a diagnosis, and then they're able to implement all this intervention based on their needs. They'll do follow-ups all the way to home visits and doing recommendation. This provides critical thinking avenues because for each stage there with the client, it calls for new approaches. So in regards, they're basically learning more on problem solving skills. Then we have helping the student understand nursing process. I want to talk more about nursing process because here is where majority of our nursing students have a challenge on. Maybe it's an attitude thing, I don't know. But basically, part of the reasons why nursing case study is needed is because it teaches our students to understand how a nursing care process is done. Because they will do nursing process management, they will approach it using the nursing care. So they will have to pull in all these components that pertains to nursing care. And anyone who still has a challenge on nursing process, we have a whole series on nursing process. Just scroll through our playlist. You'll find a playlist there written nursing care plan. Just go through all those videos. They take you through step by step on how to develop a nursing care plan and doing it right or doing it correct without you straining yourself. And the last bit is helping the student identify challenges in the family and the community. How does this come through? Being an aspect where we are doing identifying of patient needs. Remember, we've said we are moving all the way to level F, which is follow-up. So with follow-up, we are going to do home visits. And in home visits, it will be at visit 1, where we're able to do community needs, family needs, and you can identify all these needs and challenges that the family is meeting, which becomes part of the objectives of the home visits by this particular student or not. So they're able to learn, they're able to understand how to identify the challenges both in the family and in the community. Then this now gets us to the real practical bit. So what are the components of a nursing case study? What are the components? So the components relate to the objective bit, basically looks at what are we going to do while we are conducting a nursing care study. So there'll be comprehensive data collection. We are going to have critical data analysis, which is part of identifying the patient needs. And then you're going to develop the personalized care plan, which is needed for the patient needs. And then we got implementation and monitoring and evaluation. And so the last bit is evaluating and reflecting. So here you are doing the last bit of it. Like you're evaluating this case and you want to know like what has worked, what has not worked, what can be made better in the future, which management was effective, how are we going to improve on it. So it provides components of reflecting and making it better. So in summary, the components will be from data collection, data analysis, personalized care plans, implementation, and then we do monitoring and evaluation. And then come with recommendation that you feel can be implemented to manage the given case better. So thank you again for being with us all the way to this end, and I always encourage us to share our work with your platforms Subscribe also to our videos if you really see that they are beneficial, and so that you can be part of this growing community. So thank you so much, and let's meet in the next level of our series.